Hello, everyone, and welcome to our webinar, Why to Choose Endymed. My name is Asrar. I am the Clinical Research and Development Manager at Endymed. And in this webinar today, we're going to look at what makes Endymed the top choice in the aesthetic field. And we're going to cover our advanced technology, the benefits it offers, and how it can enhance your practice. So also in the second section, we're going to be joined by one of our doctors, Dr. Abhay Talati, who will share his success story. So let's discover why Endymed is the choice of professionals around the globe. So we're going to start by looking at the key radiofrequency technologies in the field. So we have the monopolar, as you can see in the diagram. The monopolar radiofrequency uses a single electrode to deliver radiofrequency energy deep into the skin. The energy travels through the skin layers to the grounding pad, which is placed on the body to complete a circuit. And you can think of monopolar as a powerful flashlight that illuminates deep into a dark room. So what it does, it rejuvenates the skin from the inside out. But however, this deeper penetration can sometimes lead to discomfort or pain, let's say, during the treatment. And it requires advanced cooling mechanism or pain management. Also, besides the monopolar, we have the bipolar technology. The bipolar involves two electrodes that are placed close to each other on the skin surface. And the radiofrequency travels between these electrodes in the shortest path. Okay, so it creates localized current that heats the superficial dermal layers. And you can imagine the bipolar radiofrequency as a focused reading lamp. It shines light exactly where you want it to. It provides targeted skin rejuvenation. But the bipolar RF technology does not penetrate as deeply as the monopolar, so it may limit its effectiveness for deeper tissue treatments. And this is where our technology comes. So Endymed's patented 3D technology was initiated in 2007, and we have earned 18 registered patents. And our technology is multi-source phase-controlled RF technology. It features, as you can see, 3 pairs of generators. Okay, the current from each pair repels the others, enabling a 3-dimensional delivery of the RF energy to dermal and subdermal targets, while minimizing the energy flow through the epidermis. So this unique setup allows for effective targeting of specific skin layers without the need of active cooling. So as the radiofrequency waves penetrate the tissue, they interact with polar molecules like the water. Okay, that's what makes the RF waves colorblind, as we call it, suitable for all colors. And this interaction between the waves and the water causes the water molecules to move rapidly, which generates friction heat and raise the tissue temperature. And you can think about it like a mini party in your skin. The waves are the DJ and the water molecules are the dancers. And here's where the smart part comes. By adjusting the frequency and the depth of the device, as the 3D technology can do, we direct the heat to the collagen-rich dermis. This increased temperature triggers biological responses. It activates the fibroblasts and make new collagen and elastin fibers. And we can think of the collagen as our skin best friend. It can remodel the skin. It's like an internal workout of the skin. It leads to gradual tightening and rejuvenation. Okay. Here we can see a thermal experiment. On the left, you can observe that with 300 watts of power and 1 second of pulse duration, the bipolar technology achieves a superficial thermal penetration of 1.5 millimeters. On the other side, we can see that with the same parameters, our 3D technology can reach up to 6 millimeters. That means that we target deeper layers and improve clinical outcomes without the need to use higher energy. Okay, now we continue to explore why to choose Endymed. So let's delve into the exceptional quality and versatility of the Endymed Pro platform. The Endymed Pro isn't just a device. We can think about it like a comprehensive system that brings together 7 sophisticated handpieces. Each one of them is engineered for specific treatment or a specific area with precise control over treatment parameters like the energy, the depth, and whether you are looking to rejuvenate, refine, tighten, lift, or contour, this cutting-edge technology has you covered. So our 7 handpieces are expertly categorized into 4 dynamic groups, each designed to address unique treatments and specific needs. And now we're gonna explore the features and benefits of each one of them. Starting with the trend of the aesthetic industry, we have the RF microneedling, or as we call it, the intensive handpiece. This cutting-edge technology not only heats the deeper layers of the skin, but also creates micro-injuries that stimulate collagen production, resulting in enhanced skin rejuvenation and tighter contours. What sets our intensive handpiece apart is its ergonomic design, first of all, and the advanced electronic step motor, which ensures a smooth and precise insertion of the needles, unlike the traditional punch or spring methods, which can be painful and traumatic for the skin. So our electronic control system provides a more comfortable experience with minimal downtime. And of course, you have a full control over the power, the pulse width, and the needle depth. And you can easily customize the treatments to meet each patient's specific needs, offering exceptional results without compromising on comfort. And with the intensive handpiece, we bring the non-insulated gold-plated needles, featuring an ultra-thin tapered design. These needles ensure smoother and more precise entry, reducing the trauma to the skin and the discomfort, and make the patient experience more comfortable. So the gold plating enhances the conductivity of the energy. It allows for effective radiofrequency energy delivery, so it achieves impressive results with fewer passes. Okay, and of course, this minimizes the treatment time and the discomfort. It also reduces the bleeding because we're using non-insulated needles and promotes faster healing. Plus, our needles, because they are non-insulated, creates micro holes in the skin. So it boosts the absorption of any topical products that you use during the treatment. The next technology that we offer is the FSR handpiece. It's like an evolution of the skin resurfacing industry. Unlike conventional treatments, the FSR handpiece utilizes pioneering matrix of 112 tiny RF electrodes or pins. And this design allows for the first time to combine between the fractional microablation of the epidermis with a deep volumetric heating in the entire dermis. So for this handpiece, we have a depth penetration of 2.9 millimeters. And we have a special smooth scanning technology, as you can see in the animation. And of course, the FSR offers superior results with minimal downtime and reduces the risk of post-inflammatory hyperpigmentation, even for darker skin tones. So you can imagine imagine the precision of the laser microablation combined with the deep volumetric heating of the radiofrequency. This is exactly what the FSR can deliver. The next group is the focused RF technology, or the focused RF handpieces. And we have the iFine handpiece. It's your go-to non-invasive solution for delicate eye treatment. We have the small handpiece that balances between the precision and coverage, and it's ideal for the trio, the face, the neck, and the décolleté. We also have the mini shaper handpiece, which is designed with a unique shape that we use it for the hard-to-reach areas. It can lift, tighten, and contour the jawline, the submental, the arms, the knees. And of course, we have the shaper handpiece. It delivers superior body contouring and skin tightening with its expansive coverage and high energy output. So each handpiece of all of those boosts a unique shape, electrode configuration, spacing between the electrodes. It enables precise control over heat, depth, and treatment accuracy. So this customization ensures that each handpiece is perfectly suited to its specific indications and areas, and delivers targeted results with enhanced effectiveness. And the last technology that we offer, or let's say the fourth category of the technologies, is the most powerful tool at Endymed. It's the contour handpiece. It uses advanced 3D RF technology to deliver precise energy into deeper skin layers, tightening the collagen fibers, and improves the elasticity and the firmness of the body areas. At the same time, we have integrated pulse vacuum suction. It enhances the RF treatment by pulling the skin closer to the electrodes, increasing the radiofrequency penetration depth, and it stimulates the lymphatic system and boosts the blood circulation for effective pain relief. So the combination of the radiofrequency energy and the pulsed vacuum suction helps to break down the fat deposits and, of course, smooth out the appearance of the cellulite. And this combination breaks also, we can do like contour and tightening for the big body areas. Okay, we can use it especially for the areas with loose skin or stubborn fat. Okay, moving forward, now let's explore like another reason to choose Endymed, which is the ability to integrate multiple technologies in one device. Don't get me wrong, each handpiece delivers excellent results on its own, but when combined, they offer even greater benefits. This approach accelerates the treatment times and addresses the most challenging cases. With the combinations, we can provide more personalized solution from head to toe with our all-in-one platform, as we like to call it. For example, we have the NDI protocol. It's a non-surgical eye lift solution. If you're addressing texture, pigmentation, fine lines, you can combine the iFine and the FSR. But if you're targeting deep wrinkles, under eye bags, or saggy skin, you can combine the iFine with the intensive handpiece. We also offer the Endybody campaign. It's designed to treat anybody, anytime. So this campaign combines the focused RF handpieces with the fractional handpieces. We address a wide range of full body indications. This includes the skin tightening, contouring, and treatment of traumatic scars, stretch marks, the photoaging and solar pigmentation, the décolleté on the hands, rejuvenation for knees, elbows, cellulite reduction, and much more. And of course, if we have Endybody, so we need to have Endyface. The Endyface campaign is your ultimate solution. The Endyface campaign is your ultimate solution for achieving radiant yet full look. So some of our protocols aim to improve skin texture, reduce scars and acne, smooth fine lines and deep wrinkles. Additionally, we offer treatments for neck rejuvenation, jawline firming, the smoker lines, nasolabial folds, and even external vaginal tightening. And by the way, all of these protocols have been developed in collaboration with our KOLs from around the world. So be sure you're getting tried and true treatments that deliver exceptional results. Next is our minimally invasive maximum impact protocols. Here we bring you off-label, unique, interesting experiences from the field. For example, the fractional handpieces have been used to treat rosacea and redness, smooth post-burn scars, promote hair health and address alopecia, and manage hyperhidrosis. They've also been used to boost PRP treatments, enhance the penetration of topicals to treat conditions like melasma, and even plump and rejuvenate the lips, and the list goes on and on. And of course, everything we have discussed is backed by over than 40 peer-reviewed publications, spanning for more than 14 years. So thank you all for your time and attention. Now I'm excited to introduce Dr. Abhay Talati from India, who will delve deeper into his experience with Endymed. Dr. Talati, the floor is yours. Pleasure to have you with us today.
Thank you very much, Asrar, and I thank the entire Endymed team for allowing me to share some of my, experiences with the lovely device of radio frequency, which I've been using since about 10 years almost now. So before wasting a lot of time, let me put my presentation. You should make me host so that I can actually share my presentation.
Okay, one second, we're gonna do it.
Okay. So Asrar has done my job easy now actually because she's already spoken about different attachments and different handpieces which we get with Endymed. And that's a big positive for having any technology in the clinic when we choose to select any machine for ourselves, because it is not something which is just one particular thing which you're targeting at, and these different handpieces allow us to do so much. So let me, rather than why choose Endymed, let me share my story with radio frequency energy. So this is probably started about 10 years ago in 2015, where I was, excited to read a lot of literature coming up with radio frequency. So we was using a lot of lasers, but then a lot of literature came in between 2010 to 2015, to be precise, about radio frequencies used in the clinical indications like scars, stretch marks with the help of radio frequency microneedling and fractional resurfacing, and in upcoming aesthetic indications that time in India about skin tightening and addressing fine lines, wrinkles also. So after going through publications, we thought of, radio frequency is something very exciting, because the biggest advantage for our color of skin in India is that the radio frequency is colorblind. So if you see all different skin types from skin type 1 to skin type 6, we are all, we can use radio frequency to equal efficacy without worrying about a lot of side effects, particularly in the skin type 3, 4, and 5, which is prevalently seen in India. So we don't worry so much about hyperpigmentation as a side effect with radio frequency as compared to a lot of lasers, like, the fractional CO2 laser, to be precise. This was my first device, and this was actually my first communication to my patients. So I took this picture to post it here. When we actually let our patients know through the WhatsApp messaging and other media that it is a unique device now available at Skin Space Clinic, and we can offer you fractional skin rejuvenation, facial and neck skin tightening, facial lines, wrinkle correction, acne scar correction, stretch mark improvements, periorbital and perioral rejuvenation, and even body contouring. And now thinking back, when I made the message, I thought over it for a while. Let us try and understand, can we really achieve so much? So let us actually dive deep into this. I think I am not able to go forward because someone wants to join the room. Yep. So this is already been discussed. I'm not getting deep into it, but the radio frequency was chosen. Why we can achieve all this is because there are three unique advantages. One is that the radio frequency which we have chosen is 3 deep, so it is overcoming two challenges. The pain of monopolar is reduced, and the depth of penetration limitations of bipolar are overcoming with 3 deep technology. And we are able to produce higher energy levels because of the multi-source. So this was shown already. This is very reassuring for a physician like me to know that the delivery of the energy is at the target, which is the deep dermis or a lower reticular dermis, where we are targeting to produce more collagen to induce skin tightening as well as to improve the appearance of scars, stretch marks, etc. Now, how we deliver that, that is actually in this
Endymed
video.
presents 3D focused RF skin science, delivering a superior, innovative solution for non-invasive wrinkle reduction, skin tightening, body contouring, fractional skin resurfacing, and RF microneedling for the face and body. 3D provides controlled energy delivery. RF energy is sent exactly where it needs to be to effect significant collagen remodeling for visible, immediate, and long-term results. Unlike other superficial RF technologies, 3D RF technology delivers controlled RF energy deep into the depth of the dermis for deep volumetric heating.
So volumetric heating is a key because when we are talking about radio frequencies effect on the deeper dermis, we are looking at higher temperatures between 50 to 65 degrees so as to produce the clinically effective regeneration of the tissue. So if the epidermis temperature around 40-42 degrees will ensure that the deeper temperatures of 50 to 60 degrees are there. And when we are doing that, particularly with the non-ablative RF, we are going to basically do it with multiple passes. So this was my first device, and these were the first three attachments which I had. One was a face attachment, a small handpiece, and a periorbital or a I-fine handpiece, and a FSR handpiece. Over next 3-4 years, we played a lot with this particular device, and then we upgraded to Endymed Pro, and then we could further attach the contour handpiece, and then the mini shaper handpiece, and even the microneedle RF handpiece. And this kind of completes the basket to offer multiple different treatments to patients. And let's see what we could do with it. The advantage of these handpieces, if you see, this is the depth of penetration chart. If you're looking at the thin area around the orbit, which is basically the eyelid and the supraorbital area, where the skin is really thin, around the mouth, the skin is thin, I-fine handpiece delivers the energy at 1.5 mm. As you go further, you look at mini shaper and a small handpiece, 4 to 7 millimeter, which is very good for face treatments. Contour obviously is for a body treatment with around depth of 26 millimeters. And fractional RF varies from 2.9 millimeters for FSR and further deep down intensive as 5 millimeters. So intensive, we are even able to achieve the targeting of the sweat glands, which can help you to reduce excessive sweating. And in body areas to treat the stretch marks, intensive is further helping a lot of our patients. So the way that electrodes are, the handpieces are developed and the way energy is delivered matters a lot in the outcomes. So if you look at overall basket of uses of radio frequency in the clinic, some people will have more clinical indications. So we have a lot of acne indications like acne scars, traumatic scars, striae, even for aesthetic indications like face tightening, eye rejuvenation, body contouring, fine lines, laxity correction. So it's not only that few indications are addressed, we are addressing a lot of aesthetic plus clinical indications. Largely, if you talk about aesthetic indications, we use non-ablative RF. And for largely clinical indications, we use a fractional RF or a minimally invasive RF. But nowadays, with safety of the device, we are playing multiple combinations. So we are even combining the non-ablative and fractional RF together in same sessions so as to get better results. These are the handpieces largely for aesthetic use. What I'm using now is I-fine handpiece for the periorbital tightening, wrinkle reduction, puffiness reduction, for perioral wrinkle reduction. And we are also using mini shaper, which is basically for tightening of the face, correcting of the jowls, nasolabial folds, and marinate lines. Mini shaper is very effective. It is basically allows a larger surface area to be covered in a smaller time, and allows us to maintain higher superior volumetric heating as compared to even the small handpiece which we used to use before. So deeper heating is helping a lot of patients particularly. So these are the whole list of indications. If you include the body indications also, the flanks, the abdomen, buttocks, thighs, excessive laxity, as well as contouring can be done around these areas. So these are some of my clinical patients. If you can see these two different ladies, I am presenting to you, and I'm presenting two important features. If you notice closely, the lady on my left has got a deep-seated nasolabial fold, appearing marinate line jowls with a little cheek hollow, whereas the lady on the right does not have a lot of volume loss, only largely sagging because of the aging process. So both these can be easily addressed. Typically, when we use a non-ablative tightening RF, we are using around 10 sessions performed over a period of 3 months. And this is the first lady treated. For little hollowing, we have even addressed her in combination treatment, but largely skin tightening. And if you can see her nasolabial fold hardly is seen. Her marinate lines are significantly better, and her jawline also looks better. And this is achieved with Endymed mini shaper. This is a combination of mini shaper, and first two sessions were done with the small handpiece of the face. 35 to 40 watt was delivered. 10 regular passes were done on each side every session, and 10 such sessions were done over a period of 3 months. Now, if you understand, when we do a tightening procedure, first 2 or 3 passes are to build the heat. So we are actually starting to do, patient does not feel a lot of heat. After 2 or 3 passes are done of 30 seconds each, the heat is developed, and then that temperature or deeper dermal temperature is maintained minimum for 6 to 8 passes, so that you get clinically basically visible outcomes. And that's the whole protocol. You have to maintain those many number of passes. If you do less passes, you may not be able to produce similar outcomes. This is the other side of the same patient. Largely improved nasolabial fold with lifted cheek, and even the area in the perioral space looks much better. Marinate lines, the shadow is less, and the jawline is better defined. And this is another lady. She could not complete 10 passes. She just came, and then probably only after 2 sessions I could catch this. She finished a few sessions, about 4 or 5, and then she did not come back for some reasons. But still, we could achieve good reduction, particularly in the marinate line, which are very bothersome to her. And even, the corner of the mouth was significantly lifted with 2 sessions only, which we did. Same number of, so we usually start with 35 degree, 35 watt, and 10 passes are done first session. As the tolerance of the patient improves, we keep increasing the number, the energy rather. 35 to 45 is largely what we use for most of our patients. And suppose what we realize is that after this patient who's actually not willing to come for multiple sessions, we can look at using Endymed Express protocol. So this was for busy people actually. This is not adoptable for everyone because we are using very high energies. So the tolerance on the part of the patient has to be really, really good. And if you look at, we do only 3 sessions, 10 to 14 day interval, and around 1 hour a session. So we are using almost double the number of passes. It's 20 passes for the cheeks and almost around 15 to 16 passes for the neck. And 50 watt energy is given. So very high energy is delivered. Patient has to tolerate a little heat because after 5, 7, 10 passes, it really starts, heating up a little. But it's a very good treatment for people who do not have time and want to finish quick, or people who are staying for a smaller duration during in the town where your clinic is. So it is for those visitors. This protocol really helps. I'm sharing one more patient with you. Actually, he came with a combination of a lot of wrinkling and puffiness around his eyes, sagging of skin, prominent nasolabial folds, and the droopy angle of mouth. And this person came and he said, "Doctor, what can we do? I would like to see some results before I book in some sessions with you." So we did a first session of Endymed, promising him that it will give him good result. we use a combination of the face mini shaper as well as eye fine for this particular person. And this is the result after first session for him. So we used 35 watt 10 passes, as I told you, as a standard protocol of ours, and 4 watt energy delivered with iFine on Endymed Pro, 8 passes per side for the eyes to lift the brow and to reduce the fine lines. And this actually made him sign for the entire uh, treatment package, we can say, where he's looking much better now after treatment. But I'm showing his first picture because every session of Endymed counts, and that brings in that satisfaction in the patients. So there's a significant reduction if you see in the lines around the eyes, both sides, just after one session. The eyelid is slightly lifted, and the area of the skin around that area looks much more youthful, with a little reduction in the nasolabial fluid, I would say. So this is what you can achieve with good energy delivery with a good system. We continue to use Endymed for a lot of patients in periorbital rejuvenation, because I don't do surgeries for the eye. So we have very less options non-surgically to treat the puffy bag, hardly any options to be honest. And also to address other challenges, which is fine lines around the eyes, and there's hollows around the eyes with a lot of pigmentation sometimes. So periorbital rejuvenation can largely be achieved with eye fine handpiece. Again, we asked the patient to sign up for about almost around 8 to 10 sessions. This was the result after 4 sessions, where we use the 3 and 4 watt energy on iFine tip. 8 passes were done on either side of the treatment, either side of the face, and this is after 4 sessions. A reasonably good reduction in the puffiness around the eyes, and a very good reduction in the periorbital wrinkling is what you can see here. A reasonably lifted eyebrow, I would say, with non-surgical treatment. So another protocol, NDIs, I think Asrar already shared this protocol with all of you. This is again a combination protocol for someone wanting quick results or someone who is not able to visit so often. So these are just 3 visits in the clinic, wherein 0 week, 4 week, and 8 week are treated with a combination of iFine and FSR. And if you don't want to combine iFine and FSR, then there's another option 3, which is, basically only FSR can also be used. So you can use all 3 probes, the iFine probe, which is a non-ablative. You can even use a microneedle RF intensive probe and the FSR probe when you're targeting the eyes in this protocol. Coming to some results with fractional technologies, particularly the intensive and the FSR. So FSR has already been shown what it does. It has got a significant minimal downtime, and it ablates the superficial skin and brings in skin rejuvenation. The downtime is significantly less as compared to any aggressive fractional laser. And the side effect which we are majorly worried about in Indian skin, which is a pigmentation, is even much lesser with the radio frequency as compared to lasers. So that is why we are using this for a lot of rejuvenation procedures. If you're targeting this for superficial scars or superficial rejuvenation, it's a wonderful system. We can even combine the small handpiece for delivering the little deeper non-ablative energy and a superficial fractional resurfacing with the FSR. So this was a scar patient. Scar along with the rejuvenation of the skin is achieved after 4 treatments. And this is done once every month for our patients, because patient level 2-3 days of downtime, and the results of collagen will slowly start. So after 2 or 3 sessions, you start seeing very good results with regards to scarring. Skin resurfacing starts showing results in the first session itself. So 35 watt were given over 10 passes and followed by the FSR level 5. And in the beginning, when we did not have the intensive between 2015 to 2019, sorry, we have even targeted the deeper isolated scars with aggressive parameters on FSR, along with a combination of small handpiece. So 10% on small handpiece around the scar area, and the FSR 5 level, about double pass was done for such patient. You could see very good results over 6 sessions. And yet another, this was achieved quicker actually. She was my clinic staff only. She was worried about this. And we have achieved this, I think, in 2 sessions. So even the single isolated deeper scars were targeted and effectively treated with FSR treatment. And even stretch marks. So stretch marks can be done very well with the intensive, but even if you're using FSR and you don't have intensive, you can use a level 5 or level 4 energy and combine with a non-ablative. It helps you to produce more collagen. this PIH which had happened, the pigmentation left after 4 treatments, disappeared over next 2 months with the help of topical anti-pigmentary creams. So that is how we have been using FSR in our clinic. And then intensive came in. So intensive actually is furthermore device, very good device to play with, and can do multiple basically wonders in the treatment. If you look at it, 25 small needles are there, and they are arranged in the line of 5 needles each. The best part of this intensive microneedling is what I feel clinically is the minimum amount of pain. So the tolerance on the part of patient is significantly good with this microneedle RF as compared to other microneedle radio frequencies which I have used. And the probably the claim is that because the needle's tip is very thin at the tip, and because we are giving less number of passes as we are using a non-insulated needle, the pain is significantly tolerable and results are good with less number of shots given. So there is less overlap to be done. So we can do multiple sessions with those 1,000 pulses available for those patients. So that is the advantage of this. Let's quickly see this, how the intensive actually works.
3D fractional technology by Endymed, the most advanced RF microneedling and fractional skin resurfacing technology available today, providing clinically proven, effective, and safe treatments. The Intensive by Endymed is an FDA-cleared motorized microneedle RF treatment handpiece available with a Pro and Pure 2.0 treatment platforms. Powered by 3D fractional RP, the Intensive stands out from other microneedle technologies with its exclusive, smooth gliding and fast operating mode, providing comfortable treatments without any trauma to the epidermis. The Intensive's gold-plated, non-insulated microneedles generate more heat safely into the dermis. Because the whole microneedle is active, not just the tip, Intensive treatments offer uniform heat dissipation and coagulation along the entire needle length, providing better collagen remodeling and requiring less passes per treatment for shorter treatment times and greater patient comfort. Fractional ablation with 3D deep heating for superior results.
So this is the depth of penetration of intensive 2.5 mm, and look at the heat generated lower down. So it's a very effective. Sorry, this is 1.5 mm. Yeah, this one. Yeah. So it gives a precise heat where it is required. Let me share some very interesting cases which we had done with either only intensive or in combination. So this is my first case to show you. 25-year-old male with multiple combination scars seen on the cheeks, if you can see. So here are these ice pick scars and then combination box scars and rolling scars. Only microneedle radio frequency with intensive done for him. The depth of the needle chosen was between 2.5 to 3 millimeters and a gradually increasing energies of 20 to 22 watt. Once every month we did for 6 sessions for this particular patient. A downtime of 3-4 days was seen in this patient because of these parameters, and these were the results after 6 sessions of only intensive microneedling. Significant reduction in the depth of the scars, reasonable good reduction in the number of scars, and the bigger scars have become much smaller after treatment. Other patient came with the idea that we want to improve the surface irregularities along with acne scars. So we chose to again select microneedle RF for him because we would want to address both the surface as well as the scars. And if you could see, he has again got multiple scars over the cheeks. 2.5 to 3.5 millimeter depth was used with 20 to 25 watt. Once every month, we did 6 sessions for him and observe his results. Even there is a texture which got better beyond the scars. So scars are definitely better, but the skin surface improved, texture improved, and even the skin tone to some extent improved. And that's the unique behavior which you see with radio frequency, that it basically brings in a lot of positive changes, not only targeting one particular area of the skin or a problem. So we could achieve a lot of benefits with combination of this intensive treatment. This is the other side of the same patient. And then we keep getting these problematic patients who have taken treatment somewhere else, something has gone wrong, or they have tried something to do by themselves and it has failed. So this 28-year-old male came to us with a lot of acne scars which were there since beginning, for which he had taken some fractional CO2 laser somewhere and even ventured into a derm abrasion treatment 2 years ago. And you can see these linear marks on his face were because of the derm abrasion treatment which was done by some physician for him, and the healing did not go well. So he had linear scars as well as acne scars, and these were like traumatic scars and acne scars. So we used microneedle RF plus PRP together. Intensive was done in a setting of 2.5 to 3.5 millimeters and 20 to 25 watt on either cheeks. After that, PRP was injected into the dermis and the subcute plane immediately. Now, PRP offered him two advantages. One is that it reduced the downtime significantly, as well as it added something to stimulate that collagen production. And if you could see, he could achieve very good results after treatment. The linear scars are almost not visible. The skin looks much more tighter and lifted, as well as the acne scars have reduced. This motivates you to also see another patient who's got a lot of aging signs. So she is just a 30-year-old girl, but considering that she has a lot of atrophic scars, she had rolled out scars, ice pick scars, but she also had sagging face with a loss of mid cheek volume. And you could see her corners of the mouth are barely visible, they're just going down. So cheek volume loss, acne scars, and sagging, all three we wanted to address. So we combined the treatment again, MNRF, PRP, and even we did few sessions of the tightening RF for her. Microneedle RF was done at 2.5 to 3.5 millimeters, 20 to 24 watt, followed by PRP injections. And these were her results. You could see a very good cheek filling, volumizing, lifting of the face, tightening of the skin because of the RF energy, as well as significant reduction in the depth as well as the number of scars. The skin tone also looks better in the post-treatment picture. So the combinations are playing wonders in the practice. If you know your device well and you know to use it properly, if you are explaining to patients the downtime, etc., you can achieve very good results. This is on the opposite side, and we could see that very good skin tightening, and she started actually looking younger without doing any aggressive anti-aging treatment like fillers and thread lips and etc. And this is a very common picture in Indian clinics where we have, multiple scars with pigmentation, hypertrophy along with atrophy. So the girl on the top had a burn scar, and the girl on the lower down, she had done a tattoo and then she removed the tattoo, put a skin graft which did not do well. So they have both hypertrophy, atrophy, as well as hyperpigmentation. So we decided to combine it with even the laser treatment. So understand microneedling can be combined with most of the other treatments. So radio frequency that way is very versatile for us. And what we did is for this particular lady, she's gone grafting gone wrong. So hyperpigmentation, hypertrophy at the grafted site. We used first topical scar pigment reducing cream, sun protection. Then we started with 6 sessions of QS and DIAG laser to reduce the pigmentation at the parameters mentioned. And then we started microneedle RF in between at 2.5 to 3.5 millimeters, 20 to 25 watt in combination. And 2 sessions of intralesional steroids were done at hypertrophied areas so as to further reduce the appearance of scar. And this is what we could achieve, in this particular lady after the combination sessions. Patient was very happy. We were happy. We are also maintaining and seeing these further results. This is another lady and one more patient of acne next to that. And if you could see here, hypertrophic scar with pigmentation and hypopigmentation at places. So topical scar pigment reducing creams, oral sun protection, oral vitamin C, along with a combination of NDIAG laser and Endymed intensive 2.5 to 3.5 millimeters and 20 to 25 watts. This we could achieve very good results. Acne pigmentation also significantly reduced. Skin texture improved. Both the patients were very happy. So another feature which Endymed brings us to us, because when a lot of non-ablative treatment or radio frequency for tightening and body contouring is not done by the doctors in the clinic, is done by trained assistants or paramedics. And safety is a very essential feature. Endymed is allowing us to have a motion sensor and a tissue contact sensor. So the machine stops operating if the proper contact of the device or handpiece is not maintained with the body of the patient. And that is a significant advantage and reassuring factor for a physician like me, that a paramedic who may not understand exactly while doing the treatment, there is no harm which can happen to patient's skin. And that is a very significant advantage, I believe, for a clinical practice. So that's why I'm mentioning here. So to summarize my thought, Endymed is a 3D technology which ensures deeper penetration of RF with minimal pain. It has 6 RF generators ensuring better results, offers multiple different handpieces for face, eyes, body concerns of laxity and aging, also offers fractional RF like fractional resurfacing for skin rejuvenation with minimal downtime, offers intensive for scar, striae, facial rejuvenation, and hyperhidrosis, and allows us to perform multiple combination protocols in the clinic so as to bring patients close to the best possible outcomes, which is what we look at minimal downtime and higher safety. So friends, what versatile tool which we look for in the clinic, the tool which caters to multiple different indications in the clinic, ensures great results, ensures high safety, and delivers high patient satisfaction. That's what would make most of our physicians happy. Thank you.
Thank you, Doctor. Thanks. It was very delightful to hear and to see your presentation. And thank you all for joining and for staying in the webinar. So hope to see you on our next webinar. So we're gonna share the information regarding the next webinar very soon. And see you soon.
Thank you very much.
Have a good day, all.